Welcome to the Sim Lab. We would like to start off your day by offering a brief video orientation to the lab, its equipment, and let you know a little bit about what to expect today. Here's Emily.
Hi.
She's going to talk to you about MChart.
Hi. MChart is the computer system that we use here at Mennonite College of Nursing. It is very similar to what you will use in the hospital. Each computer has the login and password listed on the laptop. And it will be pulled up for each of you during your scenarios here in the simulation lab. So here, listed on the computer, you'll see all of our courses listed. So you will select whatever course you're here for the simulation, and then you'll select your patient from the list that is provided for you. Once you get logged in, you'll be able to see on this main screen is your orders screen, and that shows you the nursing care, vitals, diet, activity, medications the patient's on, and any nursing communication. It'll be very important that you review this screen after you get report from your faculty during the simulation. You will have a few minutes after the S-bar for you to really review the patient's orders and their medications to make you really familiar with what is expected of you during the scenario. So now we're going to administer a medication. On the under the EMR screen, you'll see a little lock right here. Once you scan your patient's bracelet, that little lock will disappear. When you're checking your patient's ID, you'll want to double check their name and their birthday and confirm it with the patient. Now we've scanned her bracelet, and so we're going to scan our med next. And that's how you give a medication. It will come up here, the time will stamp of the appropriate time that it was given.
So this is the Pyxis, and this is what you'll use if you need to remove any medication for your patient. The password and the login will be located right over here for you. So this is just telling you that the patients and the medications are not real, so you'll just hit OK. When you get to this screen, you're going to pick your patient. This is just verifying that you clicked the correct patient. So hit yes. This is prompting you to assess for any drug allergies. And when you get to his chart, you'll notice here that he has no known drug allergies. So this is a list of his medications. So you'll click on the one you're wanting to give. This is just a double check to make sure you clicked the correct medication. And then we're just going to get one out. And then you're going to press enter. When you're ready, it'll say down here to press to open drawer. The drawer will open and your medication will be there. You'll check it with the screen, omeprazole 20 milligrams tablet. When you're finished, press here. If your scenario calls for any supplies, this is where you'll get them. Up here we have all of the Foley catheter kits that you may need. Down here we have IV fluids. Here we have our primary and secondary tubing that you'll use. And then along here we have all of our supplies to start an IV. So you'll have your alcohol pads, your flushes, IV catheters, the J-loop, tape, the tegaderm, and the tourniquets are located here. So this is all that you'll need to start an IV. And then over here we have all of our respiratory equipment. So you'll have your masks, your nasal cannulas, and any suctioning tubing you may need. If your patient calls for an incentive spirometer, you'll come here and you'll get this out. If it's a standardized patient, they can actually use this because the mouthpieces are disposable. So they just come right off. Should your scenario call to start an IV, we don't actually start the IVs on the mannequins. You'll have an IV arm in the bed that you'll use. So please use that. Should you need to change any linens during a scenario, they are all right here. So we have towels, pillowcases, gowns, sheets, pads and pillows, and bedspreads. Safety is a very important factor when caring for patients. Going into a patient's room, there are many safety checks that you want to do. The first one is checking the brake. Right now, our bed is not locked and it could easily move. So in order to engage the brake, want to see, put your foot on the brake and press down. And now our bed is locked. If you want to release the bed to move it, put your foot on release and push down, and now our bed is unlocked. But you always want to make sure you engage the brake. Here we have our panel to put the head of the bed up or the foot up, and you can always put it down. There's also panels on each side rail. In order to put the side rail up, all you want to do is pull up and the side rail will lock. If you need to put the side rail down, pull this lever and the side rail goes down. If you ever need to do CPR, the lever is right here. You pull it and the bed is in position.
Okay, so another part of safety is always making sure our patient have their call light. So you'll want to make sure this is in bed with them so they can get a hold of you if they need you. Here we have our two buttons. The red is for a rapid response. So that is for a patient who is deteriorating but they are still breathing. So that's what that will sound like. And you'll push this green button to silence it. We also have our code blue button, which is for a patient who isn't breathing and doesn't have a heart rate. So it's a little faster. And you'll also push the green button to silence that. We would like for you to press the green button after 30 seconds of the alarm going off. Over here we have our oxygen and suction equipment. So if your patient requires oxygen, and if it's by nasal cannula or mask, you'll connect it here. And then you'll turn it on by the little button over here and you'll turn it clockwise. You'll hear it come on and then you can titrate to the orders that they're given and then place it on your patient. And then here is the suction equipment in case you were to need that in any scenario. Over here we have our pulse ox, which would be used to get any vital signs that you may need. You can use this for the pulse ox. Along with over here, you can use the thermometer to get their temperature, and their blood pressure cuff is right there.
And here we have our sharps container. It's really important that any used needles get put in the sharps container to prevent injury. Over here we have gloves on. It's always important to remember your gloves in any patient situation that requires them. We have our hand sanitizer. You always want to gel in and gel out. And in some patient scenarios, if it may be needed, you might have to do a full hand washing, which is right here.
When using the simulation mannequins, it's important to obtain the correct set of vital signs. In order to do that, you will secure the blood pressure cuff onto the mannequin's arm. After securing the blood pressure cuff, you will touch where it says touch in red when cuff is attached. After pressing that button, you will press start and stop to get the accurate blood pressure reading. While that reading is being obtained, you can attach the pulse ox onto the patient's finger, where a reading will come up. In order to get an accurate heart rate, you will touch the green lettering where it says touch when leads attached. And throughout the simulation experience, you will have to continuously monitor your mannequin's vitals, and in order to do that, you will press start and stop throughout the scenario for an updated blood pressure reading. During your simulation day, you will be interacting with high-fidelity mannequins like this one, or standardized patients, which are real people. You will be noting on the high-fidelity mannequins, assessing any carotid pulses, radial pulses, femoral pulses in the groin, popliteal pulses underneath the knees, as well as pedal pulses. You will be responsible for performing a detailed lung and heart assessment, noting any changes in the anterior and posterior side of the mannequin, as well as a focused GI assessment, noting any bowel sounds. If your mannequin or patient is to be administered any fluids or IV push medications, you will be okay to administer it if it has a line set up. During your simulation day, you may be responsible for communicating with physicians, lab, x-ray, security, or even pharmacy if you're having trouble with medications or dispensing units. And you will use the number that is listed on the phone at the nurse's station. The simulation hospital has a working call-out system where there is a button in every single patient's room for nurses to respond to any patient needs. It can be answered by simply picking up the phone. How can I help you?
I need my pain medicine.
We'll be right in. You can also answer call-outs by going into the patient's room and turning off the call-out button. During your simulation day, your patient may be on isolation, where they will have a gown, a mask, and gloves available for you to use outside the patient's door, as well as an isolation stethoscope. Once you are exiting the patient's room, make sure to throw away gloves and masks, and you can place any gowns into the laundry hamper.
In the event of a code blue, we have crash carts at either end of the sim hospital. On it, there is the defibrillator with pads, the code sheets that you would write all of your documentation on, the ambu bag for giving your rescue breaths, and all of the medications that you will need are in this top drawer of the crash cart. Once you roll the crash cart into your patient's room, you'll roll your patient and place the backboard underneath them for compressions.
In order to lift the side rails, you first want to lift, then squeeze, and you want to go over the hole and slowly let go in order to engage the hole so you don't make too much noise after putting your baby to sleep. And it's important to keep the side rails up when you leave the room to keep your baby safe.
And also, if you need to elevate the head of the bed, you're going to pull out this handle and then rotate it in a clockwise, and you'll see the head of the bed start going. When you're done, you'll go the opposite direction, and then you'll stop at this position and put the handle back underneath.
For half of the simulations, you will take on the role of the observer, and you will be taking notes on the lab observation form that we provide for you, and you will be watching screens throughout the simulation lab and watching the scenarios take place. Your observations will then be used in the debrief that happens after the simulation has concluded.
At the end of your day, one of the most important things you can do for the lab is fill out our electronic survey. You will find a link to it in your ILSTU email. We compile the info you offer and discuss it at our monthly SimLab meetings, always looking for ways to improve your experience here. In closing, take a tip from last year's labbies.